Hello everyone, welcome to GrowMed. If you're new to GrowMed, subscribe to GrowMed and tap the bell icon so that whenever I post a video, you will be notified. So in this video, we will look at the important questions and the topics from which the questions were asked in the recent FMGE Jan 2024. Okay, so let's start. There was a question on the autosclerosis. Autosclerosis, a repeat topic. Okay, every year a question is asked on this. So there was an image asked of the audiogram in which there was a notch at the 2000 hertz, ठीक है, and in the case they had described a female, ठीक है, and this was aggravated when she was pregnant. So by looking at those features and the audiogram, we can come to the conclusion that it is the autosclerosis. So it is a repeat topic, a must do topic. Then next question, it was on the Meniere's disease. This is also a repeat topic. So in the question there was a case describing the features of the Meniere's disease, like the tinnitus vertigo, and the image was given of the audiogram, and from the air conduction and the bone conduction, you had to identify that it was the Meniere's disease. Then there was also another question, image based question on the radiological view, ठीक है. Some are saying that it is the Cadwell view and some are saying that it is the Townes view, ठीक है. So not sure which view it was, but it was something that a skull was given and the lateral view was given, ठीक है. Then another image based question was asked on the Bloom Singer prosthesis, ठीक है. So we use this after the total laryngectomy. Image based question was a simple image, ठीक है. So this is also a repeat topic. Then moving on to the next question, there was a question on the vocal nodule, ठीक है. So in the question there was a case and also an image was given. So in the case, they had described that she was a teacher and hoarseness of voice. She had developed hoarseness of voice. Okay. So which of the following can be the diagnosis? A very easy question. Okay. So as you can see here from the ENT, there were very easy questions asked, and mostly all the questions were from the repeat topic. Okay. So this was one of a scoring subject for this time. Then moving on to the next question, they had given an image marking the malleus, and the question was asked from which pharyngeal arch this is derived. Okay, so malleus, as we all know, that it is derived from the first pharyngeal arch. So as you can see here, a question is asked on the pharyngeal arch in integration with the ENT, so it becomes an important topic and it is a repeat topic. Then moving on to another very important topic, that is the atrophic rhinitis. Okay, so as you all know that the atrophic rhinitis, female, then merciful anosmia, roomy nasal cavity, ठीक है. So all these features were described and it was a case and you had to make the diagnosis. A very easy question, ठीक है. Then moving on to the next question, there was this nasal hypertrophy described in the question. I don't know whether there was an image or only the nasal hypertrophy was described, ठीक है. I don't remember it, and you had to choose कि whenever there's nasal hypertrophy, what can be seen. So the answer was the rhinolalia clausia. Then moving on to the next question, this was asked on the blood in the tympanic membrane. There was blood in the tympanic membrane. A case था, पूरा proper case describe किया गया था कि a patient had slapped his ears and there was hearing loss, and when you examine a perforation था, blood था, तो how will you manage this patient, ठीक है. तो you had to choose the correct option. I don't remember the options कि क्या क्या दिए गए थे question में, ठीक है. So from out of those you had to choose the best option for the management. Then moving on, another very important topic, high yield, the angiofibroma, ठीक है. So this time the question was asked कि angiofibroma में bleeding क्यों होती है, ठीक है. And I'm not sure about the answer because some are saying that it will be due to the tumor is rich in vascular supply, and some are saying that the tumor invades the blood vessel, ठीक है. I'm not sure about the answer, but you need to remember that the angiofibroma is an important topic and the question was asked on this, so you need to read all the points related to this, ठीक है. देन क्वेश्चन वाज आस्क्ड ऑन द टॉन्सिलेक्टोमी, ठीक है. टॉन्सिलेक्टोमी भी रिपीट टॉपिक है. यूजुअली क्वेश्चन इसके कॉम्प्लिकेशन पे पूछा जाता था, तो इस टाइम दे हैड टू स्टेट द क्वेश्चन. पोस्ट टॉन्सिलेक्टोमी के बाद पेशेंट को ब्लीडिंग होने लगा, बट दे हैड आस्क्ड फॉर द मैनेजमेंट, हाउ विल यू मैनेज द पेशेंट, ठीक है. सो मूविंग ऑन द नेक्स्ट question, there was a question on the nasopharyngeal carcinoma, also a repeat topic and a high yield topic. So a case was described of elderly male and he was having hearing loss and cervical lymphadenopathy. तो जैसे cervical lymphadenopathy देख लिया और options देखा कि nasopharyngeal carcinoma है, that surely go with the answer that it will be nasopharyngeal carcinoma, ठीक है. Then another very favorite topic of the examiner, that is the laryngomalacia. तो image question image था glottis का एपिग्लोटिस का इमेज दिया गया था ओमेगा शेप्ड एंड आस्क्ड कि विच ऑफ द फॉलोइंग विल बी द ट्रू स्टेटमेंट रिगार्डिंग इट, ठीक है। तो दिस इज द मोस्ट कॉमन कॉज ऑफ द कंजेनिटल स्ट्राइडर। तो लैरिंगोमलेशिया पीडियाट्रिक के इंटीग्रेशन में भी पूछा जा सकता है, सो इट इज़ अ मस्ट डू टॉपिक। देन मूविंग ऑन टू द नेक्स्ट क्वेश्चन, नेक्रोटाइजिंग ओटाइटिस मीडिया। तो ये भी केस दिया गया था एंड इन द केस दे हैड डिस्क्राइब द पेशेंट डायबिटिक पेशेंट, ठीक है, और ईयर पेन, ब्लड स्टेन्ड। तो एज यू ऑल नो दैट इट विल बी ड्यू टू द malignant otitis externa. Sorry, it will be externa. So the diagnosis was the necrotizing otitis externa, which is also called as the malignant otitis externa. Okay, so this was also a repeat topic. Then जैसे केस में दिया गया था कि डायबिटीज था, फिर ईयर पेन, ब्लड स्टेन डिस्चार्ज, यू शुड बी श्योर दैट इट इज नेक्रोटाइजिंग ओटाइटिस एक्सटर्ना। देन देयर वाज अ क्वेश्चन ऑन द डेल्फियन नोड्स, ठीक है। तो किस लेवल के नोड्स को डेल्फियन नोड्स बोलते हैं, एंड इट इज द लेवल 6 नोड्स। Then there was another question on the radical neck dissection की structures which are preserved in the radical neck dissection, and the question was except, ठीक है। तो all of the following are preserved in the radical neck dissection except, and the answer, as we all know, that it will be the submandibular gland, ठीक है। And there was another question on this, that if the first and the second pharyngeal arch does not fuse, then there will be a slight opening present in the ear, ठीक है, and the image was given of that. So this was the list of the important topic and the questions from the ENT. So I think from the ENT almost all the questions were the repeat topics, and those were very easy to solve also. So that's it in this video, guys. Thank you for watching this video. I hope you find it useful and it will help you in your preparation for the upcoming FMGE. Thank you so much for watching this video. Like the video, share it with your friends, and subscribe to GrowMed. Bye bye.